In the next step of our Finding Hope coverage, we're exploring outside Idaho to see how neighboring states are combating the opioid epidemic. 6 on Your Side's Karen Lair joins us live from Salt Lake City to explain.
Well, Don, as we've previously reported, Salt Lake City has many ties to not just the people that live in our Treasure Valley communities, but also the drugs that are entering our state. And that's one of the main reasons why we're down here this week. The Salt Lake City metro area is home to about 1.2 million people, and like many other major cities across the country, a major opioid problem. They have made some significant progress, though, just within the last year. Intermountain Healthcare Services managed to cut down on prescription opioids by 3.8 million pills. That's just in 1 year. They've cut down prescriptions by 30% for both painkillers prescribed for acute pain and the anxiety drug benzodiazepine.
We know that the two medications taken together create significant risk for a patient to stop breathing. And we know that it creates a lot of death in the communities.
Now, although Utah ranks 7th in the country for deadly overdoses, they've seen a 12% reduction in recent years. We'll be talking with Intermountain Healthcare tomorrow afternoon to learn more about how they've managed to make such a significant progress in such a short period of time. And that's just one of the stories that we're going to be working on while we're down here. We also plan to meet with a group called Utah Naloxone, and we have a sit-down interview scheduled for tomorrow morning with the Salt Lake County Sheriff Rosie Rivera. So we're going to be working hard down here over the next couple of days, and we're looking forward to learning a lot about what different agencies down here are doing to combat the opioid epidemic, and we'll be bringing you our findings here on Monday nights in our continuing coverage for our Finding Hope series. Reporting live in Salt Lake City, I'm Karen Lair, 6 on Your Side.
As we continue our Finding Hope coverage, we're exploring Boise's larger metropolitan neighbor to see how they're combating the opioid epidemic and what it can teach us about our efforts here at home. 6 on Your Side's Karen Lair spends several days in Salt Lake City to see how a community much further into the crisis is tackling homelessness, lack of treatment, deadly overdoses, and overprescribing. She joins us live in studio with part 1 in tonight's Finding Hope.
Well, Don, as soon as we got into town, it was immediately clear to us Salt Lake City has a much larger homeless population than here in the Treasure Valley, and we learned many of those people are dealing with opioid addiction. Although there's still a lot of work to do, the city, county, and state are all making major progress in efforts to keep illegal drugs off the street. Progress we can learn from here in Idaho.
A very sad situation.
A quick drive through downtown Salt Lake City or visit to Pioneer Park points out a major problem.
Us homeless people get to see it firsthand.
Ask any one of them how easy it is to find drugs, and they'll tell you.
Easy as it ever is and ever was, and ever will be,
Jason Zazweta tells us he grew up in Ancrum, Idaho, and has called the streets of Salt Lake City home for more than 10 years.
I was working in the oil field, and I tell them I was making more money than most of their politicians, working in that oil field, because I was a skilled laborer.
Jason is an admitted drug addict and not only knows many people who've died from opioids, but even recently overdosed on heroin himself, saved by naloxone.
It's a war on drugs, and it's a war, and it's going to claim, more people before it gets better.
But the city has made a major push in recent years to outlaw panhandling to prevent a thoughtful donation from funding a drug habit.
This red machine looks just like a regular parking meter, but all the money that goes into it goes to a good cause.
These meters along many major walkways in downtown encourage donations that entirely go to serve the homeless community in Salt Lake City. The goal? Turn spare change into real change.
If they're hungry, give them a burrito or a hamburger or a hot dog, but don't give them $10 because they will go right to the corner and buy heroin.
Many local stores pitch in by sponsoring meters in front of their businesses. It's a partnership among city and county law enforcement along with the Downtown Alliance and other organizations. 100% of the money donated goes to help the homeless. One step closer to what Jason says is still lacking in the community.
Compassion, like for the addict. All we can do is hope and pray for the best.
So the machines. It's such a simple concept.
Sure.
And, you know, they don't raise a ton of money. They only accept coins. So any larger dollar donations will have to be made online. But Salt Lake City police tell me they raise about $1,000 a year just from the coin donations alone. And then they divvy that money up to the different shelters and organizations within Salt Lake City that go specifically to helping the homeless.
And we're looking forward to these reports when we sent you and Doug down there last week.
Yeah.
What an eye-opener downtown Salt Lake.
Yeah, and even what we saw down there is a major improvement from where they were just 2 years ago. So next week, we're going to be looking into how the state was able to set aside $67 million for a multi-phase project that focused on a very small area of Salt Lake City. And they're prioritizing the arrest of the drug dealers, increasing access to treatment, and then eventually connecting those homeless people with housing, resources, and employment.
Information we can take back here.
Hopefully.
All right, thanks for that report, Karen. Coming up on 6 on Your Side.
6 on Your Side at 10 starts now.
Thanks for joining 6 on Your Side. I'm Don Nelson. Our top story at 10. States across the country are taking action against the opioid epidemic by suing pharmaceutical companies, expanding the availability of naloxone and increasing access to addiction treatment. Over the next few weeks, we'll be telling you what leaders in nearby Utah are doing and how Idaho's policymakers could follow suit in the future. Legislators there recently dedicated $67 million to a 3-phase project that pinpoints efforts in a specific area to help a specific population. 6 on Your Side's Karen Laird joins us live in studio to explain in tonight's Finding Hope.
Well, Don, when Utah legislators decided to make fighting the opioid crisis a top priority, they narrowed their focus to the geographic area with the biggest problem, an area close to the core of Salt Lake City, near a public park, and a place people passing by were nearly guaranteed to witness drug deals, illicit acts, and even opioid overdoses.
It was a place where few outsiders wanted to go.
This was Pioneer Park 2 years ago.
You could walk down there anytime, day or night, see people having sex, defecating on the street. You could see people with needles in their arms that were drug dealers openly in front of police, selling drugs, people buying drugs, people passed out on the street from either drugs or alcohol.
This is Pioneer Park now.
Even though you see a fair amount of homeless people on the street, it's nothing like it was.
The area in Salt Lake City became the focus of a statewide initiative in 2017 known as Operation Rio Grande.
Rio Grande was a cesspool, was a den of iniquity.
Before we started it, you could just go to any corner. You could drive anywhere you wanted in that area and buy drugs.
The $67 million project is a massive 3-phase crackdown on Rio Grande Street. Phase 1, restore law and order with efforts to eliminate the source of the problem.
Gosh, a good 100 officers went into that area and took the drug dealing out of the area.
Phase 2, with funding from the federal government, was to get addicts into treatment. That's where Randall Carlisle and the Odyssey House step in.
We wouldn't have gotten that financial expansion thanks to the federal government. We couldn't have dealt with these people. And so the situation would be the same down there today as it was a couple of years ago.
Project leaders are now in Phase 3, aiming to connect those new to recovery with housing and employment opportunities.
Nobody can complete our program successfully without having a job and housing.
The task doesn't come cheap, requiring resources from the city, county, and state, but recovery centers say the progress is worth the price tag. Typical clients at Odyssey House see success rates between 62 and 64%, but those entering the program from Operation Rio Grande are seeing a completion rate of 74%.
Every one of them says, I was so sick and tired of living that way.
The results, according to county leaders, are measurable and due in large part to a partnership among agencies at every level.
We're no longer working separate than each other. We're all coming together and trying to tackle it together because it has affected our entire county.
So next Monday night, we're going to be digging deeper into how Utah lawmakers were able to get the funding needed to expand access to treatment, nearly doubling the amount of treatment beds they needed.
So Karen, how do they know if the project is working?
Well, that's a big part of it, right? They're spending $67 million. So they want to make sure it's working. So that's also part of phase 3. So they've been able to increase the number of check-ins at Salt Lake City homeless shelters. They've also seen 164 people successfully enter treatment programs, and more than 150 people from Operation Rio Grande are now in long-time housing and employment. So it's working.
And we hope to learn from what's happening in Salt Lake City.
Yeah, we just need that money.
Just need the money. All right, thanks, Karen. States across the country are faced with a major dilemma. How do you fund addiction treatment for everyone who needs it? The state of Utah is making progress thanks to the federal government. 6 on Your Side's Karen Lair explains in tonight's Finding Hope.
Well, Don, expanding access to addiction treatment in Utah was a major part of Operation Rio Grande, where agencies on the city, county, and state level joined forces to clean up a specific area of Salt Lake City overrun by drug use and illegal activity. But since the start of that project in 2017, they've gotten more than 160 previously homeless drug addicts into long-term addiction treatment programs, many of whom are now living sober lives with housing and employment.
The program is probably the toughest thing I've ever had to go through in my life.
If you're wondering about the importance of expanding access to addiction treatment, look no further than Beverly Martinez.
I used drugs and I drank for 30+ years. I was in a bad place, made bad choices.
At the time of our interview, Beverly was just 2 days away from completing the first phase of her recovery treatment at Odyssey House in Salt Lake City, living in the treatment center since August of last year.
This program kept me alive.
Now, thanks to Operation Rio Grande, many homeless drug addicts living on the streets of Salt Lake City are getting that chance to change, given the option of entering a strict treatment program to get clean.
We tell people right up front, this is a difficult program. You have to want to get help, and you have to embrace it, and you have to go along with the flow.
Randall Carlisle knows addiction isn't cured overnight. The average length of stay at Odyssey House is 4 to 6 months.
We believe that you didn't become a heroin addict overnight or in 30 days, and that it takes a longer period than 30 days to treat the addiction as well as the underlying mental reasons why you're an addict.
But if these people are homeless, how are they paying for expensive live-in treatment for months on end? That's where the federal government filled the gaps. Utah legislators applied for Targeted Adult Medicaid, or TAM, to fund treatment for a specific adult population struggling with substance abuse.
The majority of the people that came from Operation Rio Grande were covered by TAM.
And you can't complete the program until you have stable employment and housing.
Yes, I have a job. I'm working legally. And I get to go to an apartment where I'll be living. And yes, I get to transition out of treatment into society where I'll be productive.
No doubt the federal funding made it possible, but Salt Lake County Sheriff Rosie Rivera says there's always something more that could be done.
Now that the Medicaid expansion has happened, that we're able to help a little bit more people. If we were to have full expansion, we would be able to help a lot more people.
And for those struggling to take that first step toward treatment, Beverly wants to remind you, life can get better with a little hard work and determination.
Your life is worth living. And if I can change from where I come from to where I am now, yeah, there's not anybody in this world that can't change.
Well, if you're wondering if the program is working, the answer is yes. Carlisle says typical clients that come to Odyssey House see about 62 to 64% success rate, while the population from Operation Rio Grande is seeing success at 74%, proving that change is possible. It just takes time and a lot of money. Reporting live in studio, I'm Karen Lair, 6 on Your Side.
6 on Your Side at 10 starts now.
Thanks for joining 6 on Your Side tonight. I'm Karen Lair. Don has the night off. Our top story at 10, roughly 130 people die from opioid overdoses every day in the United States. But in our neighboring state of Utah, an organization is working hard to ensure anyone who wants the overdose reversal drug naloxone can access it free of charge, no questions asked. In tonight's Finding Hope, we take you to Salt Lake County Library, where program leaders say they're saving lives.
This one is on recovery, chicken soup for the recovering soul.
Before you even step foot inside a Salt Lake County library, you're reading.
The community loves it.
Not a newly released novel, but in-your-face displays educating the public about opioids.
We want to make sure people know that we want them alive and well.
But the county's efforts to combat opioid abuse don't stop there. They started first by equipping library staff with knowledge about addiction and training to assure librarians could jump into action in the case of an overdose at the library. But what about after library visitors leave? In a state that ranks among the highest overdose deaths in the country came the need for increasing access to naloxone, the opioid overdose antidote. And what better way to access the public than the public library?
Anybody can walk into any of the Salt Lake County Library branches, and in a matter of minutes, no questions asked, they can walk out with a life-saving naloxone kit.
As long as there's not a line, they could walk right up and walk right out. And they can take two if they need to.
And although it's no questions asked, if they do have questions, they're in the right place.
So we have people whose job is to connect you with accurate, credible information and resources.
Anyone can administer naloxone.
And then this is where the actual prescription is. This sheet tells them how to do it.
And many who stop in are opening up to share their concerns for a loved one with librarians.
We see grandparents, we see moms, we see friends of someone who maybe is struggling. We have had kids come in whose parents unfortunately have a substance use disorder, and those kids have witnessed enough that they know that they need to have a naloxone rescue kit for their parent.
The project was the brainchild of Dr. Jennifer Plum, who, along with her brother, founded Utah Naloxone, inspired by the heroin overdose death of their brother.
We have way too many opioids out there. In the state of Utah, we fill 7,000 prescriptions for opioids every single day. We got a lot of kids. Guess what that means? Kids find this stuff.
As an ER doctor at a children's hospital, Dr. Plum's seen the importance of having naloxone handy firsthand.
One night I had 4 kids under 4 all overdosed on opioids from 4 different homes.
So whether it's to protect children, parents, teenagers, or the homeless, those behind the program just want the chance to help before it's too late.
The main priority is we just want them to have access to a life-saving tool.
Now, they just implemented this program into 18 library branches last summer, and just 9 months later, only by word of mouth, they've handed out more than 1,300 of those kits just through the library system alone. Now, tomorrow morning on Good Morning Idaho, we'll have much more with the founder of Utah Naloxone and details on how Utah legislators made it legal for individuals like librarians in the state to distribute naloxone to anyone who needs it without a prescription. Well, last night we introduced you to a program in Salt Lake County, Utah that allows anyone to walk into a county library and walk out with naloxone. No money required, no questions asked. That drug can save a life during an opioid overdose, which is why one Utah doctor has made it her mission to get it into the hands of anyone who might need it for themselves, for a loved one, or for a stranger. In tonight's Finding Hope, more on how the Utah legislature made it legal for individuals like librarians to distribute that drug without a prescription.
The main mission is keep people alive. Nobody can get better if they're dead.
Dr. Jennifer Plum is passionate about getting naloxone into the hands of anyone who may at any time need to reverse an opioid overdose on themselves, a loved one, or even a complete stranger.
A dad who called me recently and had saved his son on Christmas Eve night.
On top of her role as the medical director of Utah Naloxone, Dr. Plum works in the ER at a children's hospital.
One night I had 4 kids under 4 all overdosed on opioids from 4 different homes. In the state of Utah, we fill 7,000 prescriptions for opioids every single day. We got a lot of kids. Guess what that means? Kids find this stuff.
Utah Naloxone works with a long list of agencies across their state, supplying people with naloxone kits like police officers, librarians, any opioid treatment providers, and so on.
It really is about putting naloxone into somebody's hand. We can talk about it all we want. We can have ads about it all we want. It can be available in every single pharmacy, and that's not the same as putting it directly into people's hands.
So how do they get it into someone's hands without a prescription? Naloxone isn't a controlled substance, but it is a prescription substance that you'd normally have to get from a doctor, pharmacist, or some kind of healthcare professional. That's how it works in Idaho, but in 2016, Utah legislators added verbiage to their law allowing any individual to distribute the drug.
So that could be law enforcement, that could be EMS, that could be someone who works in a treatment center, that could be someone who works with those experiencing homelessness, that could be someone who works in a mental health entity. And we listed all of these, potential folks we thought would be interested, all the way down to individuals.
That made it legal for anyone in the state of Utah to provide naloxone to someone else, because from Dr. Plum's experience, not everyone has a doctor, and many wouldn't feel comfortable opening up to a pharmacist about addiction.
And I got a phone call last night, 1:30 in the morning, from someone who wants a kit, and they just weren't comfortable with their pharmacy, they weren't comfortable with their doc, they weren't comfortable with the health department, and so they're either going to go to a library, and if they can't get up the kind of gumption to do that, I'll meet them and give them a kit in probably some Maverick parking lot somewhere.
Now, since Utah naloxone's start in 2015, they've distributed 45,000 naloxone kits, equaling about 90,000 potentially life-saving doses, and they've had more than 2,700 cases where individuals have gone out of their way to contact the organization and let them know they used the kit and it helped save someone's life.
6 on your side at 10 starts now.
Thanks for joining us tonight. I'm Don Nelson. Our top story at 10, cutting back on addiction by keeping unneeded painkillers off the streets. Tonight, we learned from the largest healthcare provider in the Intermountain West on how they've cut back on prescribing post-surgery opioids by 3.8 million pills just last year. 6 on your side's Karen Lear went to Salt Lake City to see how their physicians are using science to back their movement. She joins us live in studio in tonight's Finding Hope.
Well, Don, not only are doctors with Intermountain Healthcare sending patients home with much fewer pain pills than in the past, but they're also taking major strides toward educating every person that walks through their doors about the potential addictive side effects of many medications.
78 to 80% of current heroin users started with prescription pain medication.
That's motivation enough for Dr. Jay Bishop and the rest of Utah's Intermountain Healthcare system to step up and take action in efforts to prevent playing a part in increased opioid addiction among their patients.
But what we found is we can prescribe at least 50% less than we are currently prescribing.
In 2017, Intermountain started a database compiling information from 170,000 patients post-surgery.
In hysterectomy, eye surgery, kidney stones, broken arms, knee replacements.
Their main areas of focus: was your pain adequately controlled, and did you take home more prescription painkillers than you needed? The results are eye-opening for physicians.
To say, look, you've been giving 30 Percocet tablets to patients who've had kidney stones. They're going to take on average 4.
Wow.
And in urology, it turns out the sweet spot is right around 10 tablets, no matter what we do to you, about 10. For other surgeries, a little more invasive, it's about 12 to 15. But it's not these high numbers, 60, 30, that we used to prescribe. It's far less than that.
They even take into account whether or not the patient has a higher tolerance for opioids, depending on medications for other conditions.
The physicians can go into the electronic medical record and say, okay, I just did knee replacement on somebody who's taking narcotics coming into surgery. What's the average number that they consume?
Intermountain's physicians then typically send home 2 prescriptions, one to manage pain in the immediate days following surgery, and a second dated prescription that can't be filled until a week later.
So that just in case they need it, they have it.
Since the start of the shared database, a major cutback on the number of unneeded pills sent home.
And having done that across the system, we've decreased opioid prescriptions by 24%.
Tallying up to the equivalent of 3.8 million pills in just 1 year.
It's a lot of pills that weren't going to be used for good reasons.
They've also implemented a program called Speak Out, Opt Out, Throw Out, educating patients they don't need to take opioids if they don't want to.
Patients will now say, do I really need to take these? I'm going to take the prescription. I'm not going to fill it unless I need it.
The healthcare system has also helped fund billboards around town, along with increasing signage within the hospital itself, educating patients about the addictive aspects of many medications.
Now, here in Utah, the key to reducing opioid prescriptions isn't just relying on the physicians, it's also educating the patients themselves, using signs like this to get the conversation started.
And we put wraps all over in the hospital, like in the surgery waiting area where your family's waiting for you to come out of surgery. We have literature in there. We have wraps that show the dangers of opioids. So by the time you come out of surgery and are ready for discharge, we've hit you and your family to say, hey, look, these can be very dangerous substances.
So it's pretty remarkable how much progress they've made in just a year. They're also sending home all of these surgery patients home with informational cards about the importance of getting rid of those extra pills after they're done with their healing process. So as part of Speak Out, Opt Out, Throw Out, they've also increased the number of drug take-back bins at each of their hospitals and in their pharmacies.
It is so refreshing to hear a physician talk about the pill count.
Yeah, and they're even sending some patients home just by using Tylenol and Motrin at the hospital. So people are learning, especially since they're getting this conversation started, they know that there are some ways to treat this pain that are not through opioids. And again, it's worth mentioning this has nothing to do with chronic pain patients. This is just for acute pain for people after surgeries or after some type of medical procedures where that pain is only going to last for a short period of time, because Dr. Bishop says the two are incredibly different.
Yeah, well, thanks for that report.
Acute
Karen.
pain is something that we expect to go away. Chronic pain is something that is a chronic disease like diabetes or back pain or high blood pressure that needs constant management until the pain either goes away, and in some it never does go away, so it needs constant management.
Now, as part of their research, many chronic pain physicians with Intermountain Healthcare have also been exploring alternative treatments to help their patients, finding great success so far with some things like movement therapy and anti-inflammatory steroids.